Hello, my name is Nick Dash. I'm an optometrist from the UK, and my practice has become dedicated around contact lenses, the corneal surface, corneal laser surgery, and in all these situations we need to deal with dry eye disease. It's not just something that happens in the general population, but it's something that I've dedicated my life to, both clinically for my patients, but also in terms of research and in terms of my work as honorary lecturer at Cardiff University in Wales.
Mr. Dash, we see and we read in the press more and more about something called dry eye disease. I wonder if you can explain a little bit about this disease, please.
Well, dry eye is becoming all the more prevalent, more frequent within the general population, partly because of the environment in which we are, but also the impact of medicines and effectively the very dry atmosphere that we have. The prevalence, the frequency is perhaps 50% of the population have some sort of dry eye. And in terms of that very acute dry eye disease, that's 1 in 10 people perhaps have a dry eye that impacts on their life. They start to do things differently or don't go out. They have problems with perhaps a watery eye or a gritty eye, a sandy feel within the eye. Dry eye can be a fluctuation in the vision, so it's something that you might encounter on a computer during work. It might be something you encounter and happens when you go out at night. So it impacts us very dramatically in various walks of life. So yes, it's a prevalent condition. It's something that we're seeing more and more in today's world, and it's something that we need to deal with. And we need to deal with it as early as possible so it doesn't slowly become more and more chronic and it's more and more important. Because we have glands of the eyes that produce the oils and the liquids within the tears. And if these are lost, they don't come back. So it's something we have to really deal with at the early stage. We need that early intervention. But more importantly, we need the early diagnosis. We know that a dry eye disease is something that has many causes. So we have many manifestations, many things that are happening within the eye that are actually impacting on the way in which the eye moves and the lubrication within the eye. If we can diagnose the actual cause, we can actually do something to preserve the health of the eye. We can preserve the quality of vision really by maintaining the quality of the glands that are being producing the liquids and the oils within the eyes, that lubrication. Dry eye is something that we used to find and we used to think was something to do with age and as we got older. But now, today, we're seeing that we're getting dry eye symptoms and disease in adolescence, in the teenage years. Now, this might be something that is brought about by the environment. But more particularly, it might be the mobile phones where we're not blinking enough, or when you're looking at a computer screen, the blink is infrequent or incomplete. And so this is actually impacting on the glands of the eyes that produce the oils and the lubrication. And so we're seeing the incidence and the occurrence of dry eye being far more common in the whole age group from teenage really through the 70s and 80-year-olds. Interestingly, we're actually finding patients that have dry eye syndrome that are not getting symptoms. They're not getting those common signs of gritty, irritable, watery eyes. we're actually getting some patients that don't have problems, but we can see those early signs of dry eye that is causing problems at the moment with regard to the health of the eyes, and will manifest a more and more acute chronic problem later in life. So by diagnosing dry eye disease and dry eye syndrome in the early stages, we can limit the problems that people would have later on in life.
Is it common to see dry eye, in your opinion, with eye surgery?
Well, within our clinic, we're seeing lots of patients that have had previous surgery, actually then experiencing dry eye. So this can be from cataract surgery, corneal laser surgery, LASIK. It can be patients that are using drops regularly for glaucoma or have had a procedure on the eye. Most of these patients will end up with dry eye, and it's something we need to explore and find out what the cause is, and then to deal with those symptoms so we can target the treatment to deal with the actual problem that they're having. Patients or people who've had corneal laser surgery very often have dry eye disease. They have problems on the corneal surface that needs to be dealt with. But we need to discover first what the cause of that dry eye is, and then target the treatment. It can be drops, it can be other treatments to improve the quality of the production of the glands, such as IPL, intense pulse light therapy, that can actually re-stimulate and rejuvenate the corneal surface and the tears that bathe that surface of the eye. My patients that have had cataract surgery very often have dry eye after that surgery. So we need to deal with the problem not only after, but in some cases before the surgery, to make sure the eye is really healthy for the surgery and is healthy after surgery. We also need to treat that dry eye condition with the very particular drops that are needed, that are absent from the tears. We need to do various treatments to the surface of the cornea or the lids themselves to help produce the oils and the lubrication that is required after surgery.
How important is it for our contact lens wearers to understand dry eye disease?
If you are a contact lens wearer, it's imperative, it's vital that you have your tears assessed before fitting of the contact lenses, or if you're having that discomfort or the limited wearing of your contact lenses, then very often it's the tears that are the problem, not the contact lens. So if the eye is healthy, has good lubrication, then that lubrication from the tears will lubricate the contact lens. So rather than change the contact lens if you're not getting enough wearing from the lens, perhaps the better approach is to look at the actual cause of the discomfort, which is very often dry eye disease and the lack of lubrication in the eyes. So look to treat the cause of the problem, which is actually dry eye disease, and treat that with either drops during the day when you take the contact lens out, or actually have some in-clinic treatment to improve that quality of tear.
Why is it important for our patients to correctly diagnose dry eye disease?
It's vital, it's really important to diagnose and actually have the analysis of your eyes and the tears to ensure your good, healthy, bright, sparkly eyes for the future. If we don't look after our tears and the glands that produce the tears, then these glands are lost, they drop out. And if we get a loss of these glands, they're not going to return. And we're going to be working on lower and lower levels of lubrication for the eye. Once they're lost, they're lost. So we need to look after them today and look after them by going to the clinicians, the doctors, the optometrists that can accurately diagnose what the fundamental problem is for your eyes. Once we can diagnose that condition, we can then treat it in the most appropriate way to preserve that quality of vision and the quality of comfort of your eyes for the rest of your life. It's very much undervalued by people that suffer from it. They think that just drops will solve the problem. But by using drops, you're just papering over the surface of dry eye. You're not treating the cause of dry eye. So to treat the cause, we need to diagnose dry eye very accurately. And only once we've got that definition, what the cause is, can we actually treat it effectively. So for me, don't tolerate that irritation, that grittiness, that watering of the eyes. Seek advice to actually treat this. Let's put dry eye disease in remission. And part of that is diagnosing the problem and then treating it effectively and really dealing with this as a long-term management of the health of your eye. Your visual future depends on treating dry eye disease in the most effective way. Don't live with it, deal with it.